We've all heard about broken hearts, but can the stresses of losing a relationship actually cause cardiovascular damage? Joining us to get to the heart of the matter is Dr. Chris Magovern, ABC News medical contributor and cardiothoracic surgeon at the Morristown Memorial Hospital. Dr. Magovern, great to see you again. Thanks for being here.
Great to see you, and happy Valentine's Day.
Happy Valentine's Day to you, too. We'll start with sort of the more sad side of Valentine's Day. When a relationship ends, often people have what is known as heartbreak. But is there an actual medical condition that goes along with that?
It's fascinating. There is, Tanya. And the heart can break down for a number of different reasons. We know that cigarette smoking, eating cheeseburgers and French fries can be bad for your heart. But who would have ever thought that a heartbreak or having an emotional problem or a stressful problem can actually affect your heart? And it can. And there's a syndrome that really revolves around this. Interestingly, it only affects women, middle-aged women. And the heart just quits. The heart becomes paralyzed. 3/4 of the heart muscle just stops beating. And as you can imagine, it makes you feel just awful. And the unifying theme with all of these cases is that there's some emotional or stressful element that brings it on. It may be a fight with someone at home or someone at work. It may be that you've lost a lot of money. It may be that you've gotten some news about a loved one that's died. It might be that you're even surprised from a surprise birthday party.
And this is known as broken heart syndrome.
It's called broken heart syndrome. It's also in the medical community called Takotsubo.
Sounds like a Japanese word, is it?
It is a Japanese word.
Tell us about
that.
Actually,
it's fascinating, Tanya, because the name is derived from, the Japanese were the first to describe what this looks like. And when you diagnose it, the image of the heart doesn't look like a normal heart. It becomes more swollen, and it looks like a swollen flower pot. And the Japanese likened it to what Japanese fishermen use to catch octopus. They use an octopus trap that looks like this.
Very creative.
Taka is octopus, subo is pot or trap.
Fascinating way of naming it there. But you say it only happens to women, and you say it is if they're older mostly, is that right?
It's postmenopausal women generally.
Interesting.
And we don't have a good explanation for why it happens, but because it happens traditionally in postmenopausal women, the thought is that it's hormonally related, and it's a surge of hormones that really affects a certain portion of the heart and makes it toxic.
Now, what is the difference between broken heart syndrome and a heart attack?
That's a great question, and they present the exact same way. When you present with broken heart syndrome, you have the exact same symptoms. You feel pressure in your chest, tightness in your chest. You may feel short of breath. You may feel your heart racing. You may feel weak, and that's exactly what you feel when you have a heart attack. Now, heart attacks are much more common than this syndrome, and they're actually more deadly. So the important thing is to make sure you're not having a heart attack first, and your doctors will do tests to determine that. The best test is an angiogram or a catheterization. It looks at the blood flow to the heart. Now, if you have a heart attack, one of those arteries is blocked, and that will be identified. If the blood supply to the heart looks normal and you have a paralyzed heart, you have to think about Takatsubos.
And then how is it treated?
Time, tincture of time. We've been nervous about this condition for years, and we've wondered how we could make it better. But the interesting thing is it gets better in time. It takes days and weeks. We have some medications that we can use that help the heart beat a little bit better. We even have a pump that we can put in outside the heart that helps the heart. But the best thing, and really the only thing we can do, is wait. And obviously, if this is stress-related, this can happen again.
All right. Thank you so much, Dr. Chris Magovern, for all that fascinating information. And for the latest news on heart health, head to the health page at abcnews.com.